Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at the Murray County Medical Center, and I'm here with Tom Bergman, one of our rural health clinic providers. Hello, Tom. How are you today?
I'm fantastic. It's great to be here.
Lovely. For those of our listeners who don't know you and haven't listened to previous podcast episodes, why don't you introduce yourself briefly?
Tom Bergman. I'm from Fulda. I used to work at Mayo for a little while and then came back here. It's been a great experience. I do family practice and orthopedics. I was a physical therapist in another life, so that's kind of, what I do.
Cool. So, as you know, June is National Headache and Migraine Awareness Month, so that's kind of going to be our topic for today's episode. So, I guess just to start out with, headaches, migraines are pretty common. Can you get a bit into perhaps the different types that people might experience?
Sure. So, there are several different kinds of headaches, many things that can cause them. Essentially, I'll just kind of describe what we do during the examination if you were to come in with said headache. There's lots of questioning that, things that we need to figure out. How long have you had the headache for? Can you describe any qualities of it? Are there things that make it better or worse? What time of the day or night does it happen? Are there focal neurologic deficits like visual changes, lots of things that, we would want to gather to kind of put the picture together. Some other exam pieces would be to look at our blood pressure. That can be an important thing. Look at muscles, in particular around the shoulders and neck that can be contributing. There's certain examination techniques that are used to kind of look at those. And then also we like to look at certain arteries. Sometimes you can get a type of arteritis which can lead to headaches, which we kind of need to know about if that's happening. Can be a big deal. So it's fairly extensive what we do. So as far as the types you were asking, so probably the more common ones are your tension headaches. So like related to stress or posture. Typically it starts at the occiput or like the back of the head and wraps around to the front. It tends to be fairly consistent. Usually there's not neurological issues with that, not to say that there can't be, but typically it has that classic kind of starting at the back, wrapping around to the front. There are things that can be done for it, including stretches, medications. There's specific things that can be done, what they call a suboccipital release. So that's something that we could show you how to do in a clinic visit, pretty easy enough. Other types of headaches would be, for instance, your migraines. So migraines can be with or without auras. Auras are kind of like things that you notice before the pain starts. So like if you see stars, or sometimes people can have vibratory auras, or just different kinds of feelings that tend to, I guess, precipitate the pain afterwards. But qualities of migraines would be, I would say they're usually unilateral, or they're on one side. They tend to be kind of behind your eye. You can have pulsating pain. The severity can be can vary widely. Sometimes, it can last for hours or longer. I would say most of the time it's usually aborted by sleep. So if you can, sleep it off. Otherwise, there's specific medications that are used for that. Although prescriptions are available, the first line is still your over-the-counter NSAIDs like Advils and things like that. Is always nice to try first. Another type that's common are cluster headaches. So they tend to be, they can be behind your eyes as well. They seem to come and go, not necessarily rapidly, but more frequently than migraines do. Tend to have like watering of the eyes as well. And the treatment for that, also NSAIDs, sometimes supplemental oxygen, which we can give in the clinic here. but different things. So it's nice to kind of try to narrow down what type it is and handle it accordingly. Let's see what else. Oh, danger signs. So things that are more concerning. If you have obviously a history of for instance, cancers, we worry about space occupying lesions sometimes. If it's an abrupt onset, worst headache of your life type thing, sometimes that can indicate a bleed, which needs to be figured out. If it's related to positional change, I guess not necessarily more severe, but that kind of tells us a certain way to handle it. If you say sit up or get up and you have more symptoms versus lying down, it kind of helps us figure out like what to do with it. Definitely, if you're pregnant and you get a headache of significance, we tend to worry about things that needs to be evaluated. Let's see here. Kids. I have a little topic here in kids, some things to kind of be aware of. If your child wakes up in the night with a headache, that is typically of some concern, needs to be evaluated. If they do have an aura, so like we worry about migraines there. Chronicity matters too, if it's a recurring thing. Usually, imaging isn't necessary right away for headaches, but it's nice to do it, at least once at some point. You don't necessarily have to keep repeating it, but it's nice to make sure that we don't have some sort of anatomical problem or space occupying lesion. Let's see what else. I don't know. Do you have any other questions? I feel like I've been kind of rambling here, but.
So let's say that someone has a headache and they kind of take that first line of defense as far as their over-the-counter medication to kind of halt it. Is there kind of, I guess, maybe a timeline as far as if those home remedies aren't working that you may recommend coming in for a clinic visit?
Like how long do you put up with it? That's a good question. It kind of depends. If you're a decent historian and, say you've been outside a lot and, maybe you're dehydrated or maybe you haven't been getting good sleep or, that's part of what we do in the visit too, is try to identify certain things that trigger them, So pay attention to that. Hydration is important. Rest is important, obviously. But for how long, it kind of depends. You just have to use your intuition. If it's something that gets a little bit better with your treatments, then continue on with that. But if it doesn't get any better, if things get worse, or if we start to have poor intake, or if we're, watch for progression. And another thing to think about too is, possibly infections. It's not very common to get things like meningitis, but if you have a headache and, for instance, a stiff neck, that we kind of perk our ears up if we see that, because infections in the CSF, in the spinal cord and the brain are not a good deal. So you don't want to, ignore that. But yeah, I guess everyone's situation is a little different in that regard. But if there's any concerns or questions, by all means, certainly come in and get evaluated.
For sure. And you talked a little bit about stretches and those over-the-counter medications and whatnot, and hydration. Are there any other home remedies possibly before coming in for a potential clinic visit that you may recommend people try?
Yeah, avoidance of triggers, so if we're having a headache and we're looking at a lot of screens, obviously not a great deal. Try to be fairly active. Exercise is good. For these kinds of things to prevent them, not so much while you're having headaches, but if you stay relatively active, that's good with prevention. You can try ice or heat, of course, to like the back of the neck. Sometimes if it's more of a tension muscular thing, that can be of some benefit. And the stretches are more for like the neck muscles and the upper trapezius and things that tend to kind of grab into that occiput or base of the skull, and that's something that we can show you, or you can kind of look that up online yourself. But it's nice to have someone that's done it before to kind of get you started on that. But and then as far as frequency and duration of these things, I mean, that makes a big difference in how it should be handled. I mean, I think everybody gets headaches from time to time, but if it's something that recurs on a regular basis or at a certain with a certain activity or at a certain time regularly, then just needs to be looked at.
For sure. And anything else to add before we wrap up?
Well, as far as preventative things, I'm big into that. More of a health care instead of sick care. So exercise is important. I don't think everyone does as much as they probably need to. So whether that be cardiovascular, weightlifting, yoga, just being active is important. Getting plenty of rest. Most of us don't sleep enough. Sleep hygiene is important so that we fall asleep, have good sleep. I mean, that can certainly help reduce the occurrence of headaches. Hydration, obviously, is a big one. I think most of us probably don't drink enough water, and that can lead to a lot of issues, especially this time of year. So just being proactive and trying to prevent things is important.
Very, very true. Thank you for being here, Tom.
A lot of fun, like always.
And if you need to make an appointment at the Murray County Medical Center for to visit any of our clinic providers, including Tom, you can call 507-836-6153 to schedule an appointment. That's 507-836-6153.